Okay, everybody. Thanks for jumping on and watching this live. So, as a reminder, my name is Chet Donnelly. I'm a spine surgeon here in my hometown of Dallas, Texas. And usually, what I do on these lives, I haven't done one in a while, just busy with Christmas, New Year's, surgeries, kind of normal things, family, is I try to have a theme to them. So, this one, I want to talk about spine and surgery recovery. I'll try to answer some questions as we go along, and let's just get right to it. So, in terms of recovery, the obvious disclaimers are, these results vary. Some people are like, oh, my recovery is much worse. Well, I probably wasn't your surgeon. And, there's different ways to do different surgeries, different ways to do neck fusions, different ways to do lumbar fusions, different ways to do laminectomies. So if your experience isn't the same, um, maybe you should have, maybe a different surgeon techniques gives you a different outcome is maybe the polite way to say it. So let's just jump right to it. I'm going to start with the specific surgery. First off, it's one of the most common ones I do. It's one of the most common ones maybe any surgeon does, and it's a lumbar laminectomy. Let's back up and kind of go over some terms, though, just so you know what I'm talking about. So it's something that treats spinal stenosis, can treat disc herniations, it can treat pinched nerves, but a laminectomy, so this is the lumbar spine. It's got a little tooth kyphotic there. This is the lumbar spine. Here's the lower back. And so usually when I do a laminectomy, it's usually at lumbar 4, lumbar 5, sacral 1, and that's just where most people have their arthritis. And a laminectomy is it depends on how many levels I'm doing, but if it's like a 1 level or a 2 level, which is the overwhelming majority of laminectomies I'm doing, it's an incision. Let me give you something to give you some context here. Writing utensil, that's perfect. So everyone knows how big a pin is. And I usually say, look, it's probably about this part of the pin, like that clip that goes onto your jacket, is usually the size of the incision I need. And then I'm able to kind of stretch out the skin underneath to see everything I need to do. But, if your spine, you're like, how's the incision so small? How does that make sense? Well, like your spine normally is pretty curved right here. And so a little hard to show here, but if you have an incision this big, I can kind of wand my tool from up and down and get a lot of levels because of the curvature of the spine, able to access that. Okay, so how does this work? So in terms of the recovery after a laminectomy, and I will get to some questions here, if it's like a 1 level or a 2 level, maybe even a 3 level laminectomy, so like L3-4, L4-5, L5-S1, I let my patients go home that day, especially if it's a 1 or a 2 level, or stay overnight. It depends. I have a lot of patients from out of state. They're not going back to the comforts of their home. They're going back to a hotel or something like that. So, you can stay overnight. It's fine with me. But small incision, I want you up and walking around that day. That's when I do my 1 or 2 level laminectomies. I have you can stay overnight, cross that bridge, a little different. Also if you're a little more older or not as super healthy, then of course stay overnight. The next aspect is the recovery right when you get home. Look, I'm okay for you up and walking around. I tell patients the same gist, and this varies patient to patient, but in general, I say the same things. You can shower 2 to 3 days after you get home from surgery. I want you to take that bandage off, shower, soap and water, new bandage on. The stitches I use in 99.9% of my cases are absorbable. There's something called Stratifix, so they absorb, they're kind of barbed, and they're under the skin. So you don't need any stitches out or anything like that. And people that use staples, I legitimately roll my eyes. I don't understand why people use staples in spine surgery. It seems barbaric and lazy. Different argument. I'm happy to go on the record to say that. So I use Stratifix, a nice plastic surgery closure. And from those 1, 2, 3, even 4 level laminectomies, I don't want you to lift more than 15 pounds, 1-5, for those first 6 weeks. I usually give you a back brace, something called an LSO brace. And in the overwhelming majority of cases, insurance covers those, unless you have evil United Healthcare, which I have myself. They don't cover that, even though you probably pay $15,000 a year of insurance. They don't pay for a little $150 brace, but it's fine. It's evil insurance right there. The back brace does help with support. It does help, kind of slow you down, helps keep the skin nice and tight there. So I have you wear that back brace for the first 6 weeks. After 6 weeks, I take off all restrictions. After 6 weeks, I'll let you go back to everything you like to do. Look, are you going to be ready to go back to everything you like to do after 6 weeks? Some are, some aren't. It just kind of depends on, what type of car was brought into the shop. If this is a car from, the 1960s, kind of beaten up, need a little work, it might not be ready to go run a race after 6 weeks. But if your car, being your spine, was like a Ferrari that just needed some little workup, and you're pretty healthy, very physically fit guy or girl, then yeah, you might be ready to 100% go at 6 weeks. But at 6 weeks, I take off all restrictions. Now, are you ready to do stuff? That's a little based on the condition that you came in with. I'm gonna take a little break. We'll do some questions, and I'll get to the next surgery. So I'm gonna kind of jump right to it, and we'll talk about lumbar fusions, going through the belly and screws in the back. That's another very common one. So specific stuff from Daily Griff. Do you ever do thoracic disc herniation surgeries? Yeah, just not commonly. They're just not a. It's just not a common pathology that presents, nor a common pathology that needs surgery. Another person was Sherry. I had a laminectomy L4, L5. Now, how long realistically is the recovery time? I don't know. You tell me. You're about 2 months out from your surgery, 3 months out from your surgery. Are you fully recovered? I'm not. It's a kind of weird question. You've already had your surgery, so are you recovered or not? Next question is from Lois. How to fix lower issues? How to fix lower issues when ENSO, I don't know what that means, does nothing to kill pain. Doctor says nothing to fix. I don't know what that means. Another question here. I had CRPS before my T-lift fusion surgery. My question is, what can I do to help the nerve pain? Ooh, CRPS is a very long thing to talk about. I'm not gonna be able to really address that just from this. So we do have a special guest here. He's been working diligently on his Legos from Christmas and his birthdays. He's a little man. Jack worked on, so what is this, mister?
Butterfly.
Butterfly. That's really beautiful. I love it. It's great. Do you want to say anything else by it?
Subscribe.
Thank you, little man. That was wonderful. We're the back house. We're kind of just hanging out back here. And I told him I was going to jump on and do some live streams, and he's totally happy with that because he thinks I'm silly and he likes the YouTube content. All right, let me do a couple questions here and go to a couple things. I have right side abdominal tightness. Any advice? I have no advice on right side abdominal tightness. I apologize. I don't. Okay, let's get to recovery after a lumbar fusion. So if this is the lumbar spine, bone disc, and again, there's a million types of ways to do the fusion. Are you using cages? Are you not using cages? Are they titanium cages? Are they PEEK cages? Are you going through the belly? Are you going through the side? Are you going through the belly and the side? How are you getting the screws in? Are you opening all the muscles in one midline incision? Are you making two Wiltse, two stab incisions? Are you doing it minimally invasively? Are you using robot? Are you using navigation? So you can see how there's so many different combinations, and that's why people have way different experiences. Like when people go look at different surgeons' Google reviews, you'll see there's a million patients that had like amazing, great outcomes. But when we read the comment section and different social media things, people are like, "Oh, spine surgery is the worst thing I did." Well, fair. There's a lot of different ways to do different types of surgeries. The one I'm going to specifically talk about here is an extremely common one I do, and a lot of my peers do, is when we go through the belly, and that's a great way to do a spine fusion, and then put the screws in the back. As a small subset, before I go into the recovery, people are like, "Ooh, going through the belly? That sounds crazy. Why do you do that?" Well, essentially, it's all about the cage. And look, and there's a lot of reasons people wouldn't go through the belly. One is if they do all their surgeries in a surgery center that they own and operate, it's fine. But you can't really you can't go through the belly essentially, and those type of things is just not set up for it. You need like a hospital setting, just in case something pops up. Two is they might live in a smaller city, and there might not be a lot of access or vascular surgeons, because the surgeon could do the dissection, but usually we have an access surgeon or vascular surgeon that goes through the belly with us. Like they're the one that does that. They get us there, they show me this area, and then I do this rest of the surgery from there. So those are the two main reasons why someone might not do a lot of ALIFs. They don't have those two things. Here is the big difference. An ALIF cage. So here's an ALIF cage. Here's an ALIF cage. This one's a little smaller, but ALIF, A-L-I-F, that's going through the belly. Let me see if I can hold these here in my hand. Oh my gosh. So these are two different ALIF cages. You can see they're nice and big. And then here's a very common PLIF cage. And look at the size difference. I mean, you can fit 3 of these in here, right? If that's showing up on your screen. And you might think, well, I'd rather have the smaller. That's great, right? Smaller is good. No, that's actually not totally true. Bigger is better. Why is bigger better? Getting a better with a long cage, and also those cages. When you get to the recovery here, So it's called framinal height. So keeping that framinal height open is possible. 2 or 3 2-week follow-up. If we're talking about a lumbar fusion, a 2-level or a level, or even a 3-level, is probably the same recovery in terms of. I tell people drive whenever you feel up to it.